Hi guys, welcome back. In this video we shall be talking about black stool. What are you supposed to do if you're having black stool, and what are the common causes of having a black stool, black color stool. So before that we have to understand what is the normal color of this stool. Remember, the normal color of stool is around yellow or sometimes brown, but it is very much related with the food that you eat and medication that you take. Food and medication can alter the color of the stool, right? So if you are having black stool, is it normal? The answer is no, it is not normal. It means you're having some bleeding in the upper GI tract, that is upper gastrointestinal tract. You are having some sort of bleeding. Why in the upper GI tract? In upper GI tract, in the stomach, you are having acid. You're having acid. So the blood that comes into contact with the acid which is present in the stomach, that is your hydrochloric acid, it gets converted to a black color. The color of the blood goes to a black color. So that is the reason whenever you pass your stool, that color of your stool is black, right? And what are the features of this? The color of your stool will be black. Along with this, the stool will be very sticky. Like whenever you drop your stool into the pan, it is going to get attached to the surface. It will be difficult to flush, and it will be having an offensive smell. So you have to be worried if you are having black color of stool. Just once or twice, 2 episodes, it's okay. But you're having it for a chronic time. You're having for multiple episodes. You have to be worried, and you have to be get it checked. You have to get it checked by a general surgeon or a internal medicine guy, right? So will you have black stool if you are having bleeding from your lower intestinal tract? The answer is no, because in lower intestinal tract you don't have acid, so it cannot get converted to black color blood, right? But if you're having a massive bleeding in your stomach, massive bleeding, let's say there is a artery that has been ruptured, right, in your stomach, and it is bleeding heavily, in that circumstances also the blood will be red in color. It will not be in black in color, because it is not getting enough time to get converted to a chemical compound. I'm not going to say about the chemical compound. It is not going to get enough time to get converted into color of the black. So in upper GI tract, upper GI bleeding, if you are having a very massive bleeding, in that circumstance also you can have the blood present in the stool that will be red in color, not black, but in general it's mostly black in color. This black in color stool is known as melena. Again, I'm saying the stool will be black in color, will be tarry. It will be like the tar that is used to make the road, and it will be sticky, and it will be having an offensive smell. So these are the things that you know that you might be having a bleeding in your upper GI tract, right? So yes, it is kind of gross that you're talking so much about. I'm talking so much about stool, poop, defecation, or dump, whatever is it is. But it is very, very important that we give more good attention to it. Next time you go to your washroom, please watch it. You have to watch it. That what is the color? Is there any worms? Is there any blood? The bulk of the stool, that means how much stool you're passing very less, or in a very high quantity, right? And can you see some cracks in the stool? If you're having some cracks in the stool, it might suggest you might be having constipation, right? The stool is very dry, that means there's very less amount of moisture, right? So these are the things that you have to pay attention. Yes, it is kind of a bit not so what do I say, not so good to see, but you have to do it. It's not, it's 100% natural, it is physiological, there's no problem in this. And you should not be shy in expressing to your doctor or to your healthcare provider, or ask them about your stool. Tell them it is very, very, very important that you give good attention to your stool, right? So if you're having an ulcer in your stomach, that can bleed, and that can mix with the acid, and then it will give you black color stool, right? So now thing is that if you are, let's say, the problem, what is the problem? Why will you have black stool in the first place? First is bleeding, that is your blood. And second cause is very common cause is that if you are taking iron supplementation, your the stool color will also be black. So in that circumstances, you don't have to worry so much if you're taking iron supplementation. Anytime your healthcare professional is going to give you the iron supplementation, let's say if you're having iron deficiency anemia, he is going to tell you the side effect that your stool color will be black. So that is normal, right? That is normal. I'm not saying about that. I'm just saying about the pathological causes. You're not taking any kind of iron supplementation. You are not taking some abnormal kind of food that you are not taking it in a regular basis. You tried some different kind of chocolate, or you tried something different kind of food. Once or twice it's okay, but it is going for a chronic time, very bad. Get it checked by your internal medicine or your general surgeon, right? So this is what you have to remember. Now, why will I have bleeding in my stomach? It can be due to a cancer, can be due to a lesion, can be due to a ulcer, okay, or the artery might have ruptured. So a very common reason is that if you're having an ulcer. Now, why will you have this ulcer in the first place? If you are having pain, I'll give you a very good scenario, right? Let's say, imagine I'm an old person and I'm having very much pain in my knee, right? I'm having a lot of pain in my knee, and I'm taking painkillers every day to reduce the pain. Remember, there's painkillers, NSAIDs, right? Non-steroidal anti-inflammatory drugs can cause you ulcer in your stomach. It can cause you ulcer in your stomach. Whenever you're having ulcer in your stomach, it will be very painful, right? It will be very painful. But I'm taking this painkiller to reduce the pain in my knee. But even if I develop an ulcer due to this painkiller will also suppress the pain that is in my knee, and will also suppress the pain that is in my stomach that has been caused by the ulcer. But at the same time, this painkiller is itself causing me ulcer in my stomach. So that is a very important reason that you should not abuse painkiller. You should not abuse painkiller. Take painkiller only when it is necessary, and try to endure the pain as much as possible. And even if you're taking your painkillers, try to take it for your short time, and consult with your doctor that, okay, can I take this painkiller, because this painkiller will cause you ulcer, man. It's bad, and you will not even find out that you're having an ulcer because you won't be having the pain. The painkiller will itself suppress the pain. So it's a very dangerous thing that can happen, right? So again, just to summarize, normal color is around yellow to brown of your stool. If you're having bleeding in your stomach, that bleed will mix with the acid, and then will give rise to black color. And this black color stool you will be able to see in the morning in the washroom, right? This stool will be black in color, turdy like, it will be black, turdy like, and will be sticking to the pan. It's very important. It will be sticking to the pan. So this is what you know that, okay, you might be having and bleeding inside your stomach. Again, if you're taking iron supplementation, still you will have the same presentation, but in that circumstances, the stool will not be sticky. But you will know it yourself. No, if you're taking iron supplementation, you know that you will be having a black tarry stool, so you don't have to worry so much. But after that also, you're continuing the black tarry stool, even if you stop the iron supplementation, then go and get it checked, right? So this is what you have to understand. Along with this, again, whenever you pass your stool, right, again and again I'm saying, pay attention to it. Whenever you're urinating, don't just look at the sky or look at the tiles, or just using your phone. No, pay attention to your urine, pay attention to your stool. Just see what are you supposed to see. If you see your stool is floating in water, right, it is floating in water, so it means that you are having more amount of fat that is going to your stool. Yes, it is normal that if you took good amount of fat, a very heavy fatty diet, it's okay. But if you're saying it for a chronic time, that means your body is not able to absorb the fat. That means there may be some problem with your liver, right? Same example, if I give an example, if you're passing urine, right, if you see the color of urine should be like clear. If it is yellow, you know it, you have dehydration. If you see it is red, there is some blood, and let's say I pass my urine, I see it's red in color, and I don't have pain. It is a very high chance that you might be having cancer of your bladder, urinary bladder. So you have to pay attention. If you're voiding your urine, you're passing your urine, and you see your urine is very frothy, there's a lot of bubble formation. Once in a while it's okay, but if you're having it for a chronic time, for many days, few weeks, few months, go and get it checked by your doctor. Go and meet your nephrologist, right? Because this means you are losing some protein in your urine. You are not supposed to lose protein in your urine, so there may be some problem with your kidneys. So these are the signs that you should watch out. Just watch out your stool, watch your urine. If you find any abnormality that I have told you, and the list is much more, okay, it is beyond the scope of video. Like, it will be like I don't know how big the video will be, right? So you have to pay attention to your own body, because you know your body the best. If anything feels weird, anything feels out of ordinary, get it checked, man. You never know. I might be having just chest pain here. I just might be having a chest pain. It might be just due to a muscle pain. It might be due to a peptic ulcer, or might be due to an heart attack. That is myocardial infarction. So you never know it. So you have to get it checked. So that is the reason you, as it is told, prevention is better than cured, right? The more earlier you go, the more earlier we can find out what is the problem in your body, right? So that is the reason, keep on doing regular medical checkups. That will be very helpful. Very short, if I want to say, regular medical checkups will be your complete blood count, a chest x-ray, your thyroid profile. If you are a female, mammography is very important, your kidney function test, your liver function test, your HbA1c and a random blood sugar is very important. If you are a male, prostate specific antigen. So these are and your lipid profile also is very important. So these are very not expensive tests. And do your ECG and get your heart, what do I say, get it auscultated by a physician, by a doctor. He should know how is your lung sound, how is the heart sound, is there any pathology. So go and meet your ophthalmologist at least once a year, right? You might be developing glaucoma, so you never know it, right? And go and meet your gynecologist at least once a year. For a female, you might be having some issue with that, do a pap smear. So these are the things that you have to do. It might be a bit expensive, you might think, I'm not having an issue, why should I spend my cash into it? If you think so, go and ask to a person who is sick, and try getting sick yourself, and then you'll get to know how expensive is being sick, right? So invest in your body, invest in your medical insurance, and invest in your medical checkups, even if you don't have problems. That's all I wanted to say in this video. That's all for now, and thank you for watching.